Hi guys, thanks for joining me. I wanted to let you in on a really big secret. It's a personal secret, but I'm going to share it with you guys today. My favorite disease to treat is inflammatory bowel disease. Inflammatory bowel disease is a very common disease in both dogs and cats. It's classified under the umbrella of gastrointestinal diseases, so diseases that affect the bowel. And that can be anywhere from the stomach all the way down to the colon or the rectum. Other diseases that we can see that fall under the gastrointestinal disease category are going to be things like bacterial infections. We can see viral infections. We can even see fungal infections. We can also see diseases like food allergies. We can see diseases such as cancers, lymphoma. Both large and small cell lymphoma are common cancers that we can see in the gut. Inflammatory bowel disease is generally considered to be an autoimmune disease. So for some reason, the immune system decides to go haywire and decides to attack the lining of the gut. What happens when that occurs is that all of that inflammation interferes with the cells in the gut, and so that starts to interfere with function. That interferes with movement, that interferes with absorption from the gut, that it affects the gut's ability to get rid of waste. So all of those things can occur when we have inflammatory bowel disease. Now, no one really knows what causes inflammatory bowel disease, but there's some theories. So in some cases, we believe that certain infections, viral infections like parvovirus in dogs, may set the stage up for the immune system to develop inflammatory bowel disease down the road. In some cases, we think that there's maybe a loss of tolerance. So basically, the body stops accepting the normal bacteria that are there and starts overreacting to them and trying to get rid of them. We also believe that maybe food plays a role, that in some cases the body starts to overreact to proteins, primarily proteins in the gut, but there are some cases where certain carbohydrates can cause inflammation. So all of those things are thought to impact inflammatory bowel disease. It's really a misconception that inflammatory bowel disease always causes vomiting and diarrhea, because that's really not the case. The clinical symptoms that we can see with inflammatory bowel disease largely depend on where the inflammatory bowel disease is occurring or where it's most severe. So when inflammatory bowel disease is affecting the stomach, we can see things like loss of appetite, we can see vomiting, we can see patients that have acid reflux, regurgitation, that sort of thing. When inflammatory bowel disease affects the upper part of the small intestine, we can see things like vomiting as well, but we also can see loss of appetite, we can see weight loss, we can even see diarrhea. When inflammatory bowel disease affects the last part of the small intestine and the colon, that's where we can see things like diarrhea. So any of those areas that become affected, we can see a number of symptoms. For instance, I've had 2 dogs with inflammatory bowel disease and they presented very atypically. So one of my dogs was just drooling. The other dog that I had was very nauseous, lip licking, that sort of thing. So it really didn't present with the classic symptoms, and I think that's where a lot of clients get confused. So when I have a patient that's not eating, inflammatory bowel disease is absolutely on my list. If I have a patient that's just having diarrhea, inflammatory bowel disease is on my list. When I have a patient that's vomiting, inflammatory bowel disease is on my list. When I have a patient that's losing weight, even if they feel great and are still eating fine, their stool still looks normal, all of those things make me start to think about inflammatory bowel disease. The cases that you'll see online and the patients that you'll read about, they tend to really be the classic textbook cases. The patients that are going to have the vomiting and the diarrhea and everything that you would think would go along with a problem of the bowel. And I think that's where a lot of people get confused. Now, when it comes to diagnosis, typically what we're looking for is obviously the clinical signs. Typically we're doing things like abdominal ultrasound to evaluate the bowel. to look at the thickness of the intestinal wall. We want to look at the thickness of the stomach. We want to see if there's any abnormalities within the layering of the intestine. We want to see if there's any masses. We want to see if there's any enlargement of the local lymph nodes. And then we also want to make sure that we're not missing something else, like a foreign body. We want to make sure that we're not missing disease in an organ nearby. There's blood tests that can be done to give us an idea about absorption of the gut, but they're really not going to be helpful in ruling out gut disease. And if they are abnormal, that just tells us that the gut is not functioning well. It doesn't tell us why. Really, the gold standard for any sort of gut disease, especially when we're thinking things like autoimmune disease or inflammatory bowel disease, we really need a biopsy. A biopsy of the gut is going to tell us that there's inflammation. It's going to tell us what type of inflammation, how severe, all of that. Really, when we're talking about biopsy, we want to biopsy the areas that we think are most affected, and that goes back to the clinical symptoms. So if we have a patient that's vomiting or not eating or losing weight, we want to biopsy the upper portions of the stomach and the intestines. If we're having a patient that's having diarrhea and they're going out every hour on the hour to have diarrhea and they're straining, then we want to do a colonoscopy. So really where we biopsy depends a lot on what the clinical symptoms are. Treatment. Now, a lot of my clients, when I mention the treatment, they start to kind of roll their eyes. They, get a little bit frustrated, but our gold standard treatment is steroids. So steroids are the gold standard because they're going to be the treatment that's going to help reduce that inflammation so that the gut can work well. There's different types of steroids, so even though we all think about ourselves on steroids or other pets that we've had on steroids or colleagues or family members that we have had on steroids, there's different types, so there's not always all the side effects that you think about. There's some steroids that really just work locally in the gut. There are other medications that we can use that suppress the immune system and help to modulate the inflammation in the gut as well. The downside to some of those medications is they can sometimes cause vomiting and diarrhea, and so we have to select our patients very carefully. Diet changes can be really helpful. Sometimes probiotics, sometimes antibiotics. So there's a number of things that we can add in that can be helpful depending on the symptoms. If we have a patient that's having an absorption issue and their vitamin B12 is low, then we'll sometimes supplement with that. Most patients that have inflammatory bowel disease do have treatable disease, meaning that with medications, we can make them feel better. Sorry, that's my pup in the background. So really what we're looking for is a clinical response. We want to make sure that if your pet was vomiting, that's gone. We want to make sure that if we're losing weight, that resolves and that we're either maintaining or gaining weight. If we're having diarrhea, we want to have normal bowel movements. So we really tailor the treatment to the patient and what symptoms they're having. And there's not really a one-size-fits-all sort of treatment plan. So what I may do for Fluffy may be different than what I do for Buddy. And so it really just depends on my conversation with the client, what the pet's doing, how severe their symptoms are, how severe their biopsy inflammation is. So all of those things really factor in, but often it's a treatable disease. Thank you for joining me. I really appreciate your time. Thank you.